Hello friends, Dr. Darwin here and today we are here to read about temporal bone anatomy. So as we can see, temporal bone basically consists of four important bones. To start with, first is tympanic bone, then mastoid process, third is squamous portion of temporal bone which is known as squama, and finally fourth is petrous portion of a temporal bone which is on medial aspect which is known as petrosa. I repeat, tympanic bone, mastoid process, squamous portion of temporal bone squama, and petrosa which is petrous portion of temporal bone. Coming on to first bone or first portion of temporal bone which is tympanic bone. Now as we can see, this is anterior zygoma, you can see this is anterior, mastoid is posteriorly, superior and inferior. So as we are oriented to this anatomical position, anterior, posterior, superior, inferior. So this tympanic bone forms part of anterior, inferior and posterior wall of external auditory canal. If we can see, this is squamous portion of a temporal bone. So this is tympano squamous suture and this is tympano mastoid suture. So this has got applied anatomy because it is important for vascular strip incision, because here periosteum is very tightly attached at these sutures line. So anteriorly tympano squamous suture, this is tympano mastoid suture. And anteriorly we can see that this tympanic bone forms posterior wall of glenoid fossa. So if we could see this external auditory canal, on posterior superior aspect we have spine of Henle. So here would be spine of Henle in this bone. This is less prominent, but otherwise during routine surgery is very easily palpable, which marks anterior boundary of cortical mastodectomy, and this spine of Henle lies in posterior superior wall of external auditory canal. So very important landmark when you do cortical mastodectomy. So it is a sort of anterior boundary for cortical mastodectomy. Laterally, tympanic bone borders cartilaginous external auditory canal, whereas medially if we see, there is tympanic annulus. So here would be inside would be tympanic annulus, which is very well seen during tympanoplasty or maryngoplasties, which basically houses tympanic annulus of tympanic membrane. Inside, sulcus annulus will house annulus of tympanic membrane except superiorly, as we can see that notch. So except superiorly where this fibrous annulus is dehiscent, and that is known as notch of Rivinus. So here at notch of Rivinus, tympanic membrane would be directly attaching to squamous portion of temporal bone. So that is notch of Rivinus. Coming on to squamous portion of temporal bone. So as we can see, this squamous portion of a temporal bone which articulates with parietal bone superiorly, and it basically forms lateral aspect of, we can see, middle cranial fossa. So this is anterior cranial fossa, middle and posterior. So it basically forms lateral boundary of middle cranial fossa. So it basically articulates with parietal bone superiorly, with zygoma anteriorly. Its medial surface, we can see grooves which is for middle meningeal artery, and on lateral aspect there is a middle temporal artery. So laterally middle temporal artery, medially groove for middle meningeal artery. So this is about squamous portion of temporal bone. Third, coming to this mastoid process. So as we can see, mastoid process. So there is a very important landmark here which is known as McEwan's triangle. So what is McEwan's triangle? This is identified by numerous small dots which is known as fossa mastoidea, or which is known as cribriform area. So superiorly, landmark for this McEwan's triangle, which is considered to be first site of drilling in any cortical mastoidectomy. So superior boundary is this ridge of bone which is marked from posterior aspect of zygoma goes like this. So this is known as temporal line, which is linea temporalis. So this is superior boundary. Anteriorly we have posterior superior margin of external auditory canal, second boundary, and third boundary is drawn as a tangent from canal of EAC, external auditory canal. So this is this triangle, if you can see. So this is this triangle which is known as McEwan's triangle, first site of drilling. I repeat, superiorly we have linea temporalis, temporal line. Anteriorly we have posterior superior margin of EAC, and then finally a tangent from EAC which completes this triangle. Fourth portion is petrous portion of temporal bone. So as we can see, petrous portion of temporal bone, this is petrous ridge. On medial aspect we have this elevation which is arcuate eminence, which is for superior semicircular canal. Then we have internal auditory canal opening, where we can see all those four openings for facial nerve, for superior vestibular nerve, for cochlear nerve, for inferior vestibular nerve. So this is petrous portion of a temporal bone.